Hi everyone, thanks for joining. We'll just give people a couple of minutes to trickle in and we'll get going. All right, we'll kick off now then. If other people want to join later, then they can do. Hi everyone. Hope you're all well on this Thursday morning. And thank you for sparing the time to join us today. I'm Lee Spanner. I'm Sector Improvement Lead at Student Minds. So I currently lead on our two sector improvement programmes, which are the University Mental Health Charter and Student Minds SUs, which we're going to talk a bit about today. I'm joined by my colleague Amanda and Ben and Connor from York SU, who are going to introduce themselves in a bit and share a bit about, they've been kind of members on the programme since the very start in 2019, so share a bit about their experience on the programme as well. So I'll introduce them just later. Let's say we are recording the event for those that weren't able to join us today, and so do feel free to keep your cameras off if you wouldn't like to appear on the recording, but otherwise it'd be lovely to see your faces and hear your voices as well. We will have some time towards the end, hopefully a good half an hour of the session, to do some questions and answers. So please do wait until then. But if you have a question that comes to mind as we're going through, then do feel free to pop it into the Q&A chat function, and we'll get to it at the end when we're doing the questions and answers. So yeah, without further ado, I guess today is all about introducing you to Student Minds SU's programme. So we'll take you through who Student Minds are initially, if you've not come into contact with us much before. I'll give you a bit of context about student mental health and where we're all at with that and how important that is, considering the last year in particular. And then we'll introduce a bit more about what the Student Minds SU's programme is, where it's come from, how it started, and what benefits you'll get as a member on the programme as well, and the next steps in terms of how to apply. And then, like I say, we'll hear from Ben and Connor about some of their experiences of being in the programme and some of the things that they've been using to implement some of the learning that they've gained from the programme as well. So, who are Student Minds? So Student Minds, first of all, we're the UK's student mental health charity. We work with multiple levels of the sector to support student mental health and the mental health of the university communities more broadly. At a local level, we work directly with students through our peer support groups and our campaigns groups that exist through a number of universities throughout the country as well. We also work with student unions, universities and accommodation providers by providing training to staff, and through our improvement programmes, like I talked about before, the University Mental Health Charter for universities and Student Minds SUs for student unions, which we're here to talk about today. We're an evidence-based organisation, so we also take part in conducting research, either independently or together with other organisations, such as the Student Mental Health and Research Network, SMARTN. And we've got a number of published reports on our website as well. We use our evidence base to make policy recommendations or influence regional and national bodies and the government as well. We also create digital resources. So Student Space, for example, was a big resource we created during the pandemic to support students in navigating mental health and wellbeing issues they're facing through the pandemic context. So a bit about why student mental health. Now, you're all here today, so I'm sure you're all aware of how important this is, but I just thought I'd share a few kind of key facts and stats and insights that we've gained through the past year as well. So we know even before the pandemic that the number of students declaring pre-existing mental illnesses to their university had more than doubled since 2014 and 15. We also know that the complexity of mental health issues are on the rise. So there are more students experiencing suicidal ideation, self-harm and episodes of psychosis. And we know that mental illness is not just an issue in itself, it has a massive impact on student academic experience, and they're more likely to withdraw from university, to underperform, and they're less likely to secure higher level employment and go on to postgraduate study. And we know that still too many students are unfortunately taking their own lives. And student mental health is more important than ever. So throughout the pandemic, Student Minds set up a listening infrastructure. So we've been gathering all sorts of data and insights from students, both primary and secondary sources, to make sure whatever we were doing in the pandemic was really grounded in their perspectives and experiences. And here's just some highlights of things that we've learned over the past year as well. So that students have consistently reported worsening in their mental health overall, and that their mental health is worse than it was in autumn 2020 as well. And students and young people in particular have had worse mental health outcomes throughout the pandemic and experienced some of the more negative effects than the general population as well. Students in an NUS survey reported feeling concerned about their own well-being. We know that they're more likely to report feeling lonely and isolated. Our primary research with Alterline found that 66% of students often felt isolated or lonely. And this is higher for first year students as well, who are obviously coming into university for the first time, weren't necessarily able to build the networks of support that other students might have been able to. And all students have engaged less with their peers during the pandemic as well. We're going to release an insights report very soon in July, just one for your calendar, which gathers together all this insight that we've been gathering over the past year, and presents it to the sector with some recommendations for how we can move forward and support student mental health going forward as well. We also know that staff mental health has been impacted, probably researched less so, in particular SU staff hasn't necessarily been researched on a national level, but we do know that across the higher education sector, burnout, difficulty with remote working, maintaining work-life balance, these things, and increased job insecurity as well, have all had an impact on the mental health and well-being of our staff. And we know that staff mental health and student mental health are interrelated and interdependent as well. But seeing the bigger picture, we know we've already said that the challenges to student mental health existed long before COVID-19. Some of these issues have been exacerbated by the pandemic, such as financial difficulties and health inequalities. Others have been shaped by the pandemic, so we're seeing more issues around access to learning and digital poverty. And other challenges are new, such as exposure of clinical students to COVID-19 and lockdown measures preventing PGRs from undertaking their fieldwork. We know that although kind of restrictions are easing now and the vaccine rollout is going fairly well, that the impact of the pandemic is not going to disappear overnight, and that student mental health and staff mental health and the impacts that are felt right across society will outlast the pandemic. So it's important that we do keep mental health a priority on our agenda over the next year and beyond. So what can SUs do? So as part of the programme, we've developed a mentally healthy SUs framework. So this really sets out what key ways and key roles SUs play in ensuring they can make positive change for staff and student mental health and wellbeing. And it also sets out some key principles for good practice for how SUs can start to create a positive impact in all these different ways as well. So some of these roles just include a service provider, so not all, but some SUs have advice services and centres that are often approached by students for advice, but involved in signposting and links with other services as well. You support welfare and wellbeing networks of students, often campaign for change and improvement in the academic sphere and mental health and beyond. Community building is a huge one. So all the student staffs and clubs and societies and sports teams create that sense of community that students feel, all the events that you put on as well, even the spaces that you have, the bars and the clubs, some of you, and cafe areas are all part of that community building and preventing that sense of loneliness and isolation, which students often is a massive risk factor for mental health and wellbeing as well. Another one, you're often a volunteer manager and develop student leaders. So all those presidents, secretaries of student societies, your sabbatical officers, anyone who's a volunteer has two roles. First of all, they're leading students. So they're often involved in creating spaces for students that can have a positive impact on their mental health and wellbeing, and role modelling for students as well. But they're also approached by students often as a trusting person or a trusting leader, and students might approach them with difficulties. So how they're trained and how they approach mental health and wellbeing can have an impact on student mental health more broadly. And you're an employer, so you can have, SUs can have a massive impact on the mental health and wellbeing of the university communities through their staff. So this is both in terms of how they support their staff to have a healthy work-life balance. And in this, we include sabbatical officers as well, because they're staff. How they help them to be open about their mental health and wellbeing with their line managers and create mentally healthy working places for them, but also how they support their staff to hold conversations with students who might be presenting with mental health difficulties and ensure they're able to signpost effectively as well. And the last one is critical friendship and partnership with the university. So universities are absolutely, student unions are absolutely key in ensuring that the university is taking as well a whole university approach to mental health and wellbeing, and can be really important in not just in campaigning, but in participation in committees, in those more formalised structures, and in the relationships you build with university staff and leadership can really have a positive impact on mental health and wellbeing when used effectively. So they're just some of the ways and some of the roles SUs can play that we set out in the framework. And the framework also outlines good practice. And we know that SUs are already having an impact on mental health and wellbeing in all these different ways. So when we talk about a whole union approach to mental health and wellbeing in the Mentally Healthy SUs framework, we mean that SUs are taking a strategic, conscious and positive impact on mental health and wellbeing in all these ways, and not just doing it kind of incidentally. And the programme really sets you up this year to achieve that. So I will pass over to my colleague Amanda, who will talk you through a bit more around the programme itself.
Yes, hi everyone, I'm Amanda, and I work with Lee, as you said before, with the Student Minds SUs programme, but also supporting the work we do with the University Mental Health Charter. What is Student Minds SUs then? So Student Minds SUs is a program that's designed to empower you and your student unions to become leaders in mental health. The program was created by our head of engagement, Ollie Casper-Hope, who prior to joining Student Minds had a long career in student unions. We have historically worked together with passionate people of student unions across the country, but the program came into fruition from us Student Minds wanting to work more strategically with student unions. So in 2018, Ollie held consultations with SUs to gain information on if there would be any interest and what type of support SUs would want when working with us. So following these consultations and program development, and we were really happy that in 2019 we launched the first iteration of the Student Minds SUs program. It was then called the Student Union Support Program, and we co-created this program together with our 11 first adopters, one of which is with us here today, like I said before, York SU. And student unions play a vital role in ensuring that universities are places that support positive mental health and well-being. And the program really aims to equip, support and develop partners to tackle challenges relating to mental health in higher education and play a leading role in shaping a better future. Due to COVID-19, we have reimagined the program to be low burden and low cost, and allowing members the flexibility to engage more with the support offers, the topics and conversations that are relevant to you. And this year we are keeping the program low cost and low burden for one additional year. We've also listened to you and being less responsive to the COVID-19 pandemic, which last year's program was, and we're working this year to help you to achieve a long-term strategic culture change in a more structured way. So who is the program for? The program is for SUs across the UK who are committed to mental health and well-being, who want to become leaders in mental health and are ready to create positive change. The program and the mental health issues framework promotes culture change. So we also seek SUs who are ready to kind of challenge current ways of working, because we can support you, but we also have to do some work on your own between sessions. So what does the program then include? At its center, we have the mental health issues framework that Lee touched on before. We have developed this framework based on consultations with SUs, based on research from the University Mental Health Charter and other research that we've conducted as an organization. And like Lee said, it contains 10 principles of practice and outlines that whole union approach and how to achieve that. And everything in the program kind of links back to our mental health issues framework. Is kind of the star of the show, if you will. The second thing that is included in the core package is access to our digital community, and this is where you can interact with other members of the community and share resources in between events. So the third thing that we have is monthly network events. So we will have network events that are directly linked to each principle in the mentally healthy SUs framework. Lily, if you would go one slide forward, please. You can see some of the, so here are some of the top topics that might be included. So for example, creating a strategic commitment to mental health and well-being, or using student insight to inform your approach to mental health and well-being. We'll have some thriving sabbatical offices, or creating a shared language and understanding around mental health and well-being at the SU. So these are just a few examples. We'll be releasing the full list soon. And if you would go back again, please, Lee. The fourth thing we have in the program that is new for this year is a progress review meeting, which is an opportunity for you to get together with a member of the student mindset improvement team for 3 annual progress review meetings, and in those you will reflect on your progress towards the mental health issues framework, and you also have the opportunity to get advice from the student minds team. We also have regular briefings and insights in the program. As student minds, we have a lot of knowledge on student mental health, and we will share learning from our national research projects, our listening work that Lee mentioned before, and other program work such as from the University Mental Health Charter and Student Space as well. And new for this year, we have coordinator meetings. So lead staff contacts from each SU will have the opportunity to come together regularly to share updates on their progress and key learning. And this is based on feedback we had this year that we wanted to have even more opportunities to share our progress and learning with each other. And the final thing that you will get as a member of the Student SU's community is access to bespoke training and support. So if you go forward for me, please, Lee. You can openly see. So the training that we have is, for example, look after your subs, which is a practical workshop looking to kind of support the culture and ensuring that we have well supported sabbatical officers. We have an add-on on campaigning and creating positive change. We have strategy workshop and introduction to mental health and HE, as well as an appraisal visit that kind of looks at your strengths and improvement areas according to the mental health SUs framework. We also have add-ons that give you a discounted access to our well-established train-the-trainer programs, look after your mate, and mental health in sports. And if you would go back again for me, please, Lee, to the kind of, so this is the core base package, and the fee for that this year is £1,455 plus VAT, and then you can customize your program with the add-ons that you would like, if you want to do so. That is the program in a nutshell. We will now hear from Connor and Ben from York SU, and after that we will have questions. So I will give the floor to Ben and Connor.
Thanks, Amanda. So I'm going to try and, I'm the Chief Exec at the University of York Students' Union, and Connor will introduce himself in a minute. He works with us as well. I'm going to try and tell really quickly, I suppose, the story of where we came from in terms of being really interested in working with student minds. And then, you know, I suppose all of us gradually learning how to get the best out of one another and support one another in the right ways to where we are today and our plans for the future. And I guess going back several years, I think I recognised, and some of my colleagues, some of our elected officers, some of our staff recognised that mental health was far, far too important for us not to address it, that we needed to have some difficult conversations about mental health, both within our own staff populace, within our elected officer populace, within our clubs, our societies, our students, and you know, wider institutional life. But that to have that conversation about mental health, this really difficult, quite scary and complex area, when you're talking about people's lives and well-beings, their feelings, their relationships, we needed some expertise to help us with that. You know, it's a dangerous area to work in without a kind of a rigor and a quality behind you that we recognise we need. So that led to a whole bunch of conversations with Ollie Casper from Student Minds and indeed others, where we were trying to explore the sorts of interventions and support that we might need to help us kind of kick on, I suppose. And so we were one of the early adopters, if you want, of an early version of the SU partnership program, which I think has been maturing really, really well as we and Student Minds have learned more and more as we've gone. One of the things I got wrong at first was that I banked a little bit too much on what is frankly an excellent reputation that Student Minds have. So this is a reflection on me, not on Student Minds, but I guess early on I could see that Student Minds had this incredible credibility. It was widely valued by students, by universities, by the government, you know, and you know, it had a real substance to it, that credibility. So whereas sometimes students' unions, we aren't seen as specialists and experts in student mental health, we're seen as kind of fun shops and cheerleaders who are jumping on a bandwagon or something. We wanted to marry together USU's expertise as a service deliverer, our expertise in student life at York, with the expertise of kind of student mental health experts at Student Minds who are connected both with students but also with academic specialists and kind of practitioners and mental health practitioners. So we knew we were buying into almost a kind of brand association that would immediately give me and our elected officers more credibility when we spoke to the university. And I think we banked on that a little bit too much, because of course what you quickly realise is, like a gym membership, you can't just buy the brand association, you actually have to put some effort in as well. And so I guess we were a bit lazy in the first year. Again, that's a reflection on USU, not anybody else. And we kind of felt like we bought this partnership with Student Minds, and that's it. Mental health will be fixed then. Now, great, brilliant, we're all great. And after as time passed, we realised we needed more than that, and that we needed a quality of regular connection, input and output, to student minds that would deliver real activities and outcomes. And certainly that's something that Connor will talk about in more detail in a minute. Roll forward to the, really the last 6 to 12 months for us, and the set piece, if you want, for USU, I feel, has been two key things. Firstly, in the last 6 months, student minds have used that some of those frameworks they just showed you, that whole union approach, as a really useful framework to help us explore both the breadth of what we do around student mental health, but also the depth of what we do around student mental health. And I think so firstly, that helped us do this big reflection exercise, 2 days, a whole host of kind of staff and officers, managers, directors, all sorts of people in a room, facilitated by student minds, to kind of to use that framework to look at what we already did and think about where we might want to take that in the future. Now that for us, we were quite surprised when we looked, we were using the framework, we were quite surprised by how much we were doing. We thought the quality of what we were doing was a little bit inconsistent. And I guess we started to realize through the framework that we could prioritize really, really well. Rather than try and do a million things simultaneously, let's try and prioritize some of our weaknesses perhaps, or use some of our strengths a bit better. So that was a strategic review piece of work where they really helped us both with the framework, but just with some good quality facilitated self-reflection. It's quite hard to self-reflect in a really honest, kind of self-evaluating, self-critical way. And I felt like Student Minds helped us with that. And then secondly, they did this, I've forgotten the correct terminology, apologies Amanda and Lee, but they did a kind of an external review for us. So they came in and they interviewed lots and lots of people to talk about, I suppose to try and almost test some of our prognosis, test some of our self-assessment, to tell us how things were or weren't landing, to review, again, the depth of what we were doing, and so that they could help give us almost this kind of external review analysis that will really help us to as I say, drive some of those new strategic priorities we've got, right from kind of trustees through senior management, thinking about, do we have the right people in the right place? Do we have the right investment in the right place? So from a very high level, that has been an immensely valuable project. But I'm going to hand over to Connor to talk about, I suppose, the fine detail of some of the activities we've been working on with Student Minds.
Hi everybody, I'm the community manager at USU, and I suppose I've taken the lead on some of the projects that we've collaborated with Student Minds on from an operational perspective. So whilst Ben's touched upon the strategic top-level approach that we're wanting to take as a union, I just thought I'd give an example of how some of this work with Student Minds can then translate into activities for students, particularly with the add-ons that Amanda has just spoken about. So about 18 months ago, we started to develop a scheme that we couched as mental health champions, and that is based off of the Look After Your Mate workshops that Student Minds run. But within the whole union approach and the framework, we also knew that student leaders and peer-to-peer support is really valuable, and we also wanted to involve students really in this, I suppose, co-production of mental health literacy and investment. So what we did was work with Student Minds to develop a slight different approach to the Look After Your Mate, which is, I suppose, in terms of title, Look After Your Members. But whereas the initial scheme was to train university staff to deliver a mental health literacy session to students, so they are able to provide peer-to-peer support and also look after their own well-being when doing it. We adapted this so that we trained up students to be the session leads as well, and we felt that was really valuable because we understand that students to some degree kind of listen to their peers more than they do staff. And the scheme has been really successful, and we were able to take it in myriad directions. So over the last 18 months, we've done 3 rounds of recruitment, 20 champions each time available to apply for the role. And students would submit an application, we would interview them and also give them personalised feedback as well, because we couched the scheme as well into an opportunity for personal professional development for students to develop their employability, and that's been really well received through that. And the deal is essentially they will get that experience of applying and interviewing. They'll receive this training from Student Minds of how to become a trainer and deliver this session on peer-to-peer support and personal wellbeing. And then they will deliver 2 sessions for us to either members of a student group that they're a part of, or would basically open up the session to students at York. And we essentially have just come to 2/3 through that process. And our last round of recruitment that's just finished, they'll deliver it into the autumn term. I think for me, the way that I would reflect on this, that is it's been incredibly positive. It's allowed us to expand the number of opportunities and activities we've been able to offer our students regarding mental health. And we've seen an oversubscription in interest. We've always had more applications than there were places for champions. And we've done a review, and just as a kind of example, we've surveyed the current champions on whether they agree it's benefited their personal development, whether it's improved an understanding of student mental health and the support available both in York and in general, and also whether they enjoyed running the sessions themselves. And that was scored on a scale of 1 to 5. And the average score has been 4.66 for all 3 of those, and we've not had less than a 4. So it's been really successful. We're really proud of that work. And I think that that's just one example of, I think, how we can operationalise and put into practice the offer that the SUSP has, and how we can then translate that and really kind of, I suppose, curate it to suit the needs of our specific institutions. And thanks to Student Minds as well for all the help in putting that together, because and we know that we've piloted that as a new kind of route of delivery. I think that's it from me.
Oh, great. Well, thank you both, Ben and Connor. That's really helpful to kind of really contextualize a program and how it could be useful, and also some of the key learnings about, what's actually required from an SU as well. You make a good point, Ben, that often it might come as a bit of a surprise to some SUs at like how much work some of this actually does take, but that means that you get results. So we've got some time for a Q&A now from the floor. So if you have any questions, do feel free to either pop them in the Q&A box or raise your hand. I think you can do that on the participants tab there, or stick a thumbs up or something like that, and we'll catch you there. But yeah, I think we've had one question in, or a couple of questions in already. So actually, I'll take the first one. If that's okay, just around looking after your SABs without the core membership. So this refers to one of the add-ons we've got, Look After Your SABs, from Jane there. And just to say that the add-ons are only accessible with the core programme, as a lot of the add-ons aren't necessarily standalone programs. There's only kind of the Look After Your Mate stuff that we provide as a standalone thing, not to SU members. They've been designed with SU members, for SU members, and are very much based around that mentally healthy SUs framework, and require the contextualization that's provided from that core program and from the events and the work that you'll be doing at that kind of strategic level as well. So it really does need to be embedded within the program and not delivered as a one-off. But do get in touch with us with any questions like that, because you never know, there might be a way in which we can kind of adapt our approach depending on your specific needs at your SU as well. Cool. We've had another question from Jane around, Connor, this one's for you. Are your champions paid or volunteers?
They're volunteers. So essentially when we went out, I suppose, to offer for the opportunity, it was just the expectation that they'll deliver 2 sessions, and they can either do that individually, because that's what they're trained up to do, but also if they're a little bit nervous about delivering a session themselves, they can partner with another champion. So we've had a couple of instances where they've done that, though most of the champions have been happy and confident to go along and deliver it themselves.
Well, thanks, Connor. Yeah, so such a great example of a really successful program. So happy that our training could have been part of framing that for you guys as well. Cool. Another one from Naomi Brown around, do we operate in Northern Ireland? Amanda, do you want to take this one?
Yes, and yes, we do operate in Northern Ireland. We have a member currently from Queen's Belfast SU. So and the program is open UK wide.
Thanks, Amanda. Another question from you, potentially from Emily. Could you provide a bit more information on the mentally healthy SUs framework, Amanda? I could flip to the slide which has the network events on, because that basically outlines some of the core principles that are in that framework that will help you to achieve. But Amanda, you take it over.
Yeah, sure. So the mentally healthy SUs framework is kind of like we said before, it is taking you through kind of what roles the SUs have in the mental health sphere, and also how to achieve this whole union approach. We have those kind of 10 principles of good practice, and also information on how to kind of model the principle and how to achieve that. So one of the principles is around creating having a strategic commitment to mental health and well-being. Another one is kind of around being able to use student insights and having that embedded in all that you do. We have another one is about sabbatical officers and their well-being, and making sure that they are thriving. The same for staff, and also is about kind of understanding student union's role in the wider support landscape. So embedding good practice there. Yeah, and just I guess also about co-production and co-producing services with together with your students, and working in partnership with the university, being that kind of critical friend is also highlighted in the framework, as well as kind of having both for staff sabbatical officers and student leaders to have competence and skills to deal with disclosures, and what type of support you need to kind of have in place for that. So it kind of outlines all these different things. I don't know if you Lee want to add anything.
Yeah, I guess a bit of the context, like with the program as a whole, this was started very first in that very first session. I think Ben talked about with our first 11 SU partners, where we started to scope out all the roles that SUs play in this space and what good practice looks like. And then so it was developed in partnership with them, and we also trialed the framework in a few of those appraisal visits that Ben also shared and talked about, where we went into SUs and tested the framework to see whether we've captured everything that we needed to within that framework. It was reviewed by our clinical research lead at Student Minds as well, and Cool Insight, if anybody, if you come across him, Steve Cool, he reviewed it as well. He was a director at NUS Wales previously, and has worked with lots of SUs and sabbatical officers in this space, so he provided a bit more of that framing as well. And it was only published in this last year, in the last cohort, and the partners have just really taken to it and really used it to structure some of the work that they've been doing around this work, around mental health and well-being. And this is why this year they said, actually we want the programme to be really focused around this through the network events, and that's why we've got a number of network events. Ben, I don't know whether you wanted to feed in just kind of practically from an SU's perspective any more about how the framework has been useful for you and how you've engaged with it.
Yeah, could you go to the slide just before this? I think that's the one I'm after.
This one?
Oh, no, sorry. Was there one with the,
all the roles in it. I think I know which one. This one.
Yes, thank you. Yes, that's the one. Thank you. I mean, look, so I explained to some extent, we're a fairly large union, okay? We run physical spaces and buildings. We have several hundred employees, a mixture of staff and full-time career professionals. We have well in excess of 800 representatives covering academic reps and liberation officers and so on and so on and so on. So I'm very lucky. Our students are very lucky, and I'm very lucky, and Connor's very lucky. We have a lot of opportunities to do a lot of things, and I recognise not everyone has. Now, we used this framework, the whole union approach to mental health and wellbeing, to really start to understand, almost everything we do, and to try and I suppose, at least have the opportunity to reflect on all of those areas. Now, that's because I've got I've got a small team who are supporting our clubs and societies. I've got a small team who are specialising in training and development for communities. There's all these different people who can engage in, all of those areas simultaneously. I've got a HR team who are thinking about our responsibilities as an employer. We've got mentors for our SADs and so on and so on. But even in a small union, you are still, and I know this from personal experience, you are still doing incredible things in at least one or more of those spaces. You're maybe doing it with less resource, but you are definitely doing some of those things. You have sabbatical officers who are negotiating with, pro-vice chancellors and vice chancellors about their institutional mental health strategy. And will they benefit from being able to get a bit of support in that space? Yes, they will. You might say that your small and specialist union is the thing that you're really excelling at. Perhaps your future growth strategy is going to be around the way you do community building and through clubs and societies, and so that that's the thing that you're going to target. So I suppose you might recall I talked about being kind of surprised by the breadth of what we do, and then trying to pick some priorities where we wanted to do depth. So really improve our quality. And it's the same philosophy, using the same framework, I guess I'd say, regardless of whether you're a massive union, somewhere in the middle, or tiny. I hope that's a helpful contribution.
Yeah, it's really helpful. Thanks, Ben. And we have had some smaller universities. I think books are quite small, aren't they, Amanda? And York Graduate Student Association as well. And both have been able to put together some form of, action plan, at least for the next year, and this informed by this. I guess it's worth noting that, we do say that this does take work, and to achieve a full whole university approach, you do need to create the time and space to have those conversations with, involving trustees, involving senior management team, involving the rest of the staff team around what does mental health and wellbeing look like across the organisation. So it's good to have the leadership commitment to give you that time and space to do that thinking and that reflection. But in terms of the implementation, I guess it's just like Ben says, it's prioritising where you need the time and the resource around that. And the point of the framework, as like Ben said, is embedding it in things that you already do. It's not necessarily, none of these things are additional to the work you're already doing. It's just, how do we ensure that your priorities in mental health and wellbeing are the things that you're already doing? So in that sense, once you've done the thinking and have the space and time to do that, the doing should just be part of day-to-day activity, in theory. And yeah, so it's always great to have loads of resource behind this, but it can be done, and you can do a lot of work around this stuff with limited resources available as well. Cool. We had a question about the core programme price after 21-22 and the cost of each of the add-ons. Amanda, do you want to take this?
Yes, so we will be working together with the cohort of this year, 2022, in kind of what the program will look like going forward. So like we said before, due to COVID, we have reimagined the program to be a bit more low cost and low burden. And that's kind of the reason for the prices, the price that it is now, but we will work together with the cohorts to kind of understand what support and review the program, which will be 3 years this year, and kind of come up with what it's gonna be looking like going forward. So in terms of saying what it will cost going forward, I can't really answer right now, because we'll be looking at how we can continue to improve the program and kind of what type of program it will be, so to say. Each of the add-ons, each add-ons cost you can find in the price list, in the fee list, sorry, and I can send that on to you.
Is that uploaded to the website yet, or is that going to be uploaded to the website, Amanda?
It will be uploaded today.
Okay, cool. I'll stick the link in. Oh, I actually can't do it because I'm sharing my screen. But if you could stick the link into the website, Amanda, then to the chat box, and then that's where the fee list will be uploaded onto the website. Cool. We have another question about the digital community. Amanda, do you want to take this one as well?
Yes. So the digital community is currently hosted on Tribe. So it's almost a little bit looking like Facebook, but it's a dedicated space for the community members to be able to come together to ask each other questions, share best practice, share resources. There's also where we provide updates about the program, and also share resources from us as well. And we will have a few different ways of getting engagement on there. For example, we'll have we're looking into having a weekly question to kind of spark debate and conversation. But it really kind of is what you make of it. But it's there for members to be able to interact with each other easily, and to be able to receive resources and share resources and things like that.
Oh, great. Thanks, Amanda. We did have another question in, Connor, around some of your experiences. I know you've been a regular at some of our network events this year as well, the monthly events we put on, which have obviously all been online this year. Could you tell us a bit more about your experience with those and what they're all about?
Yeah, I think it's just, I mean, that's another part of being part of the programme that I think is really beneficial. So Student Minds run a number of health inequality network events, which are essentially centred around either a particular student demographic or a particular issue, where members of staff and SABs from different SUs come together. There's often a presentation from Student Minds staff about the issue at hand. So, for example, I've recently been to one on LGBTQ plus students' experiences and mental health at university, and one on working class students. And then there's, it's really just a bit of an open forum to have discussions about, you know, how we can support these students, any kind of different initiatives. So they're just really good opportunities for best practice sharing. And similarly, there was one a few months ago that was also around the mentally healthy SU framework as well. So other SUs that are currently part of the programme met and discussed their different approaches to how they're reflecting and evaluating themselves against the 10 principles, and also any kind of way they're starting to operationalise that activity to put, I suppose, the strategy and the talk into practice. So I would just say that, again, the different elements of the programme you can access that I personally have found really beneficial. And I know that some of the colleagues who've attended them have found them useful as well.
Thanks, Connor. Yeah, and this year, like we say, the network events we're hoping to be really structured around that framework to provide you that kind of step-by-step approach through the framework and also share in depth in those different themes around what SUs are doing around those particular themes as well. So hearing case studies and sharing issues and challenges so that you can really start to, rather than thinking about analysing the issues more broadly and taking the insight, actually starting to put that into practice. And what does that look like? Now we're in the third year of the programme, everybody seems to be broadly at that stage. Cool. We did have a question as well about our Positive Minds and Eating Difficulties peer support workshops on the website. Just to say that our peer support things that we run at Student Minds, they are run by student volunteers. So that's if a student volunteer approaches us and wanting to set up a peer support group, then we'll train them to be able to do that. There's often an SU or a university colleague who kind of works with them to supervise the peer support groups there. So they're not a part of this programme officially, although that is something we've been talking about. How do we link up these programmes a bit more effectively in the future? And they are very much that kind of the more intensive peer support, so peer support groups where students come together as a group to discuss eating disorders, or the Positive Minds ones is a bit more about just generally well-being and managing well-being like that. But if you're interested in more about those, do get in touch with us, send us an email anyway, and we can link you up with one of our peer support manager who runs those groups as well. And again, through the programme, the SU programme, there'll be lots of opportunities to potentially learn from the good practice that we've got from our other programmes that we run at Student Minds as well. The Look After Your Mate, however, that's more of an informal peer support, and that is run through the SU's programme, and as Connor says, has been used to set up those more kind of informal peer support networks where student leaders are trained to be able to respond if a student approaches them with difficulties and ensure they're set up to signpost that onwards. So that's a different kind of peer support. If peer support is something you're interested in, that might be a useful resource to you as well. Cool. A question from Anna is about getting buy-in from senior management team and any tips. Ben, you seem in a prime position to answer this question.
Well, you know, it's all these nasty senior managers who won't give you the backing you need, isn't it? We're an awful breed. I mean, look, I think I said in opening that mental health is too important not to address, and that requires some investment, be it around time or be it around money, or both. We managed to secure some support from the institution. So the institution have made a financial contribution over a 3-year period to our work in and around mental health, which included a contribution towards our Student Union Partnerships Programme fee. So, you know, it may well be that your senior management can make a bid to your institution in order to leverage some funding support for them, because ultimately, you know, the good mental health of your staff, your volunteers, your students, probably, you know, makes people more productive. It makes your students attain at higher grades. It means there's less sickness rate. I mean, there's loads of, you know, immediate kind of value for money, as well as kind of socially responsible reasons to invest in this space. The real issue is, can your senior management secure the funds for that investment? Have certainly helped some of the students' unions. You know, we've shared drafts and things to try and help one another get successful bids to our vice chancellors and whatever. So you know, if your senior management want to get in touch with me to try and see how I've managed to leverage funds here, I'm happy to share and compare and see if I can help. But let me just reassure you that I feel sure they will want to. It's just they might need your help thinking about how they articulate this really compelling business case that secures the necessary money.
Yeah, I think that's the issue, Ben. I completely agree. The wants to do something like this. So I'm sort of a lone mental health wellbeing worker, student advisor in the union, quite a small SU, and I think, you know, I've been sort of trying to champion all these things, and there's a lot of good stuff and good conversations that are happening, but when it comes to putting the money where those conversations are, it becomes a little bit more tense and difficult to try and get the buy-in. So I completely agree. I don't think it's about not wanting to do something like this. It's about trying to find that funding. But right enough, I think the university, there was something I'd already sort of mentioned, so I'm hoping that's maybe a route that they can look a little bit further into. But yeah, that's been useful.
If they, you know, tell them to get in touch with me if I can be of assistance, because I'll try my best. And I know colleagues at Student Minds will help if they can as well, with, you know, character references or you know, descriptions of the programme and some of its benefits to a whole university approach as well.
Yeah, I've got what I would say is the resources that you've already sent out, and Student Minds have already sent out about the programme and things has been great, because I've already been sort of like bombarding them in their inboxes with all these kind of different sort of really easy to read and digest information about the programme. So hopefully that has got them on the right track. It's just continuing that patient bombarding, I think. Fingers crossed. But no, I appreciate that, and I will certainly put them in touch with yourself if that's something that they will hopefully find very helpful. Fingers crossed. Thank you.
Yeah, thanks, Ben, and thanks, Anna. And yeah, if you do need anything, any like data or stats or anything like an outcomes or anything like that might be useful. I know different managers like things framed in different ways depending on your particular mission or strategy or values and things like that. We can definitely support with any of that. Might also be worth thinking with the university if they're thinking of or interested in the University Mental Health Charter, that whole university approach, that could be a way in as well, because these programs do, or we hope they will, start to link up really nicely with that network as well, because SUs are a key part of that whole university approach, and obviously can support, and as part of the charter, the whole idea of student voice and participation being a huge part of that as well. And if the SU's got the resource behind it and the expertise to be able to hold those conversations and drive that strategy as well, then that's only going to be beneficial for the university. So things like that as well might be useful levers to pull. Cool. All right. Well, we're just about done. So sorry if you had another question and didn't get around to asking it. Do feel free to drop us an email as well. Got too many windows open now. And I will leave Amanda to just wrap up about where we can get more information and how to apply.
Yes, thank you, Lee. Yes, so first of all, just thank you all for your questions. And like Lee said, if you have any further questions, please send them to susupport@studentminds.org.uk. And if you haven't downloaded our information pack already, or received it from us, then please do so. You can find the link in the chat box, or you can go to our website, press Get Involved and Student Unions, and you should find it there. Applications will officially open on the 1st of July and closes at midnight on Friday, the 6th of August. And to apply, please email susupport@studentminds.org.uk to receive a registration form. And yeah, just thank you for joining the session, and we hope it's been useful for you, and we hope to see you really soon as members of the program. Thank you.
Thank you, everyone. See you now.